Before starting aripiprazole, make sure to read the medication guide provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. The extended-release injection should only be used if you have already taken aripiprazole by mouth without any serious side effects. Aripiprazole is given by injection into the buttock or upper arm muscle by a healthcare professional, usually once every month. Some doses may be given once every 6 weeks or once every 2 months. Do not rub/massage the injection site after your dose. After your first injection, your doctor may direct you to continue to take your antipsychotic medication by mouth, such as aripiprazole tablet/solution, for 2 to 3 weeks. This will help maintain the right level of medication in your body as you switch from receiving medication by mouth to receiving it by injection. Follow your doctor's instructions carefully. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. It may take several weeks to get the full benefit of this medication. Use this medication regularly to get the most benefit from it. To help you remember, mark the days on the calendar when you need to receive the medication. Tell your doctor if your condition does not improve or if it worsens. Some common side effects of this medication include dizziness, lightheadedness, drowsiness, tiredness, blurred vision, weight gain, shaking, and redness/pain/swelling at the injection site. If any of these effects persist or worsen, notify your doctor or pharmacist. Dizziness and lightheadedness can increase the risk of falling, so be sure to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the risks. While many people using this medication do not experience serious side effects, it's important to contact your doctor immediately if you experience fainting, trouble swallowing, restlessness, especially in the legs, seizures, or trouble controlling certain urges, such as gambling, sex, eating, or shopping. In some cases, this medication may rarely cause your blood sugar to rise, which can lead to or worsen diabetes. Watch for symptoms of high blood sugar such as increased thirst or urination, and inform your doctor if you experience these symptoms. If you already have diabetes, monitor your blood sugar regularly and share the results with your doctor. Rarely, this medication may cause a condition known as tardive dyskinesia, characterized by unusual uncontrolled movements. Contact your doctor immediately if you develop any of these symptoms, particularly in the face, mouth, tongue, arms, or legs. In some cases, this medication may lead to a serious condition called neuroleptic malignant syndrome, NMS. Seek medical help right away if you experience symptoms such as fever, muscle cramps, severe tiredness, confusion, sweating, fast/irregular heartbeat, dark urine, or signs of kidney problems. While a serious allergic reaction to this drug is rare, seek medical help if you notice symptoms such as fever, swollen lymph nodes, rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. If you're in the US, you can also report side effects to the FDA, and in Canada, you can report them to Health Canada. Before using aripiprazole, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have had problems with receiving injections into the buttocks, blood flow in the brain, blood clotting problems, diabetes, heart problems, nervous system problems, obesity, low white blood cell count, swallowing problems, breathing trouble during sleep, or if you are using marijuana. This medication may cause dizziness, drowsiness, or blurred vision. It's important to avoid alcohol, marijuana, and activities that require alertness and clear vision. It may also make you sweat less, increasing the risk of heat stroke, so be cautious when doing activities that may cause you to overheat. If you experience fever, mental/mood changes, headache, or dizziness, seek medical help immediately. Before having surgery, make sure to inform your doctor about all the products you are using, including prescription and non-prescription drugs, and herbal products. For older adults, there may be an increased sensitivity to the side effects of this drug, so it's important to be cautious and seek medical help if any serious side effects occur. During pregnancy, This medication should only be used when clearly needed, and it may pass into breast milk, so it's essential to consult with your doctor before breastfeeding. If you have any concerns or if you are planning pregnancy, become pregnant, or think you may be pregnant, discuss the benefits and risks of using this medication with your doctor. And, if you have any untreated mental/mood problems, such as schizophrenia, it's crucial not to stop taking this medication unless directed by your doctor. It's important to be aware of potential drug interactions that may affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. This medication may interact with other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Be sure to inform your doctor or pharmacist if you are taking any of these products. Additionally, check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. It's best to ask your pharmacist about using those products safely. If you or someone else has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include a rapid heartbeat and loss of consciousness. Your doctor may perform lab and/or medical tests, such as checking blood sugar, weight, and cholesterol/triglyceride levels, while you are taking aripiprazole air, 2-month, 960 mg per 3.2 ml suspension, extended rel-im syringe. It's important to attend all your medical and lab appointments. If you have any concerns, make sure to consult your doctor for more information. Make sure to take each dose of aripiprazole air, 2-month, 960 mg per 3.2 ml suspension, extended rel-im syringe as directed by your doctor. If you happen to miss a dose, be sure to consult your doctor or pharmacist for a new dosing schedule. Your doctor may also advise you to take aripiprazole by mouth for a period of time if it has been a certain number of weeks since your last injection. Be sure to follow your doctor's instructions carefully. This medication is administered in a medical facility and should not be kept at home. It is used to treat certain mental/mood disorders, such as schizophrenia and bipolar disorder. The dosage and frequency of administration will be determined by a healthcare professional, and it is important to follow their instructions carefully. This medication is usually injected once every 2 months. It is important to take the medication at the same time each day to maintain a consistent level in your body. Be sure to discuss any concerns or questions with your healthcare provider. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.